Hi again, I'm Dr. Fuentes from the Fuentes Cosmetic Surgery Center. Like I told you, I'm going to talk to you about the other parts of the face and how we look at them and evaluate them. When we look at the face, one of the things that I look at is the nasolabial fold. I also look at the wrinkles around the face. I look at the definition of the mandibular rim, whether or not I can see it clearly. I look at the jowls. I look at the chin. As we get older, we lose tone on the chin, and it falls. I look at the submental area to see if they have any bands in here, and to see if whether or not they have adipose tissue in there, meaning fat. With respect to the nasolabial folds, our goal is not to completely eliminate them. If we eliminate them, you would not look normal. So our goal is to improve them when we pull. There are other ways we can treat them. We can treat them with injectables, meaning hyaluronic acid, calcium hydroxyapatite, or fat injections. I don't like the fat very much because I do not know how much of it will stay. With respect to the wrinkles in the face, we distinguish two things. One is ptotic or hanging tissue for which we need to operate and lift, and the other ones are wrinkles for which we could treat with laser or other ablation procedures such as peels and dermabrasion. The definition of the mandibular rim, in general, that requires some suction and lifting. The jowls, the same, mostly lifting. The chin, we can correct with a chin implant, or we can inject them with calcium hydroxyapatite or other injectables. The submental area, we need to either do liposuction and eliminate the medial proximal bands, which we cut out and stitch together. But you don't need a facelift all the time to correct that area. I'm going to show you now an example of a case in where we did not do a facelift. This lady you will identify because that little tiny mole in there. Underwent suction of this area, placement of a chin implant, removal of that mole, and tightening of those bands. That alone corrected her problem. So as you can see, sometimes smaller procedures are all you need. Thank you so much for your attention today. Looking forward to seeing you soon with more examples of things that we do and how we correct them. Thank you.